Hello there, I am Mabel Zhang with the World Healthcare Congress Interview Zone, and I'm here talking with Dr. Jeffrey Rose, who is the Chief Medical Information Officer over at TriZetto. Thank you so much for being here, Dr. Rose.
Pleasure, thank you.
Well, the company is a nationally recognized healthcare informatics firm, and I just wanted to ask you, how involved is TriZetto in helping clients navigate healthcare reform right now?
We're very involved with most of the claims. Approximately half of the claims in this country come across the software that we have sold to payers and health plans who use them to manage their networks, to manage claims and reimbursements. So there's an enormous footprint of clients who use the software to do that.
Okay.
So there are large amounts of data that flow back and forth. We also have connections with over 200,000 care providers that help them manage their revenue cycle. So bringing what's happening in the office together with what's happening and with what payers will reimburse for begins to bridge the gap between providers and payers and allow them to see information on members across a community. Population health is becoming one of the biggest areas and of course accountable care as well. And to be able to gather that data, not only from the electronic health record but also from the claims database is vital to what we do.
Now, in terms of changing the structure of reimbursement, and coding will have to factor in there a great deal as well, correct? I mean, that seems like an enormous job, coding procedures and then figuring out how much these procedures cost. So when you're putting in all this information, are we going to see a shift in how these bills will look at the end of the day and what consumers experience when they receive bills?
I think we will see a change. First of all, there's the change to ICD-10, which is going to affect everybody within the next year. So that's something we're helping people with. There's the value-based payment system and being able to bundle and share risk, which requires a lot of payer information. What are things costing? So we don't determine what those charges or costs are. We provide the software infrastructure for our partners to be able to do that. But we do have a number of programs available to help with the bundling, with the unbundling, with the episodic care. And then of course we have a lot of products that have to do with how patients are experiencing the billing process when they see their providers to begin with. So those two are being brought together. And our next move is to begin to integrate the clinical data and provide that in the same real-time way across many of our channel partner EMR vendors and other partners in the healthcare industry.
Is it hard to consider what the next step will be when so much information is yet to be seen, when it seems like that we have the accountable care organizations coming up with different ways on which they should be structured and other organizations saying that they want it to look this way? How do you fit into the picture?
There's an administrative piece which the payers are really very good at, and there's the clinical piece, and the two come together around the patient and around what quality is. So if we focus on the patient and we focus on quality, which is really safety, plus the value of the interventions, so we can assess what the interventions were and what the outcomes were, and then the appropriateness of the interventions. How much did they cost? Were they really necessary? Are they evidence-based? What is the reason? Analyzing all of those things together requires us to pull all of this data together to do it.
Are you seeing a lot more collaboration for obtaining the data you need to move forward?
We are beginning to see a lot more collaboration and a lot with our EMR vendors who are beginning to share data with each other, as well as our channel partners who are actually submitting claims through some of the software that we use. So yes, we're seeing a lot more partnerships not only in the industry but also with the providers themselves.
What panel did you speak on at the conference, Dr. Rose?
We just spoke about using information from different sources to advance population health management.
And what were the key takeaways from your end on what you wanted to leave the audience with?
I wanted to leave the audience with with the impression that we have a lot of work to do to prove to providers that the information that we're giving them from the payer side is trustworthy, and that we all have a lot of work to do on both sides, the electronic health record side and the payer side, to be sure that the data matches and that it's reliable and dependable and useful to then launch kinds of clinical or business decision support that helps with the business as well as with the quality of care that the patients are getting.
Will the consumer notice any sort of difference in the way they receive care or pay for care in the coming months?
They absolutely will. We have a pilot going now in Tennessee where at the time that the patient is seen by the provider, they know exactly what they're going to have to pay, exactly what may require an authorization, and of course the providers love this, the patients love this. Money that's not collected appropriately at the time of the visit, because there isn't a real-time approach, is typically never collected. And providers and payers both want the patients to know, or the consumers to know, what the cost transparency is for what is being recommended, and they want to work with their patients to make these decisions rather than have them made in some arbitrary way. So I think there will be a difference in how our consumers experience healthcare going forward.
Simpler?
Simpler, that's exactly correct.
Do you think, how much money do you think is lost in the system from people who don't pay just because they're confused on what to pay?
Well, that's a complicated question.
But is there money lost?
There is money lost. Our estimates are about 40% of what is not collected that should be collected at the time of the visit, because nobody knows what the plan rules are, never gets collected. And as higher deductible plans come into being as a way to begin to share risk, that's only going to become more of a problem for patients.
And premiums will go up because
premiums will continue to go up until we get a handle on appropriateness and safety and quality, at which point we'll be doing the right things together as a group. We'll be managing health in the population rather than just illness visits, and the total cost of care should go down.
Certainly there has been a lot of questions on how to best to move forward. What's your best word of advice here?
We need to cooperate and coordinate, first at the information level, and second at the programmatic level around the way in which we approach the disease burdens in our populations and the way in which we appropriately treat chronic illnesses in particular, which cost a significant amount, and the efficiency with which we connect providers to each other and to payers for care so that the whole system has less friction.
Okay. Dr. Rose, thank you so much for coming by.
Thank you.
I appreciate your time.
My pleasure.
And I'm Mabel Zhang. Thanks for watching.